The Ministry of Health and healthcare in general in Ukraine is really one of the only institutions that hasn't been changed and hasn't moved forward at all for 25 years. It's kind of a system that is barely functioning, if we even say that it functions. It really doesn't even exist anymore. It's really in the rubbles. And I'm from Detroit personally, and we all know what happened in Detroit in the last, say, 15 years, where there was an economic crisis. A lot of the factories closed down, the automobile industry went bankrupt, and a lot of the businesses closed down, and Detroit became sort of the poster city of when things go wrong and when you don't modernize and when you don't keep up with the times. So when I was in Detroit visiting my parents at Christmas time, I saw these T-shirts, Detroit versus everybody, and it made me think of it's the same thing that's happening now in the Ministry of Health. We're kind of, really sort of almost like the worst of all of the ministries, the worst of all of the systems. Everything's falling apart. Everybody complains about it. Everybody thinks that there's absolutely nothing that can be done to save the system. But we're scrappy Detroiters, and we're going to come back and we're going to build this up, and we're going to be the best ministry out of all of them, and we're really going to save things. So when I brought the T-shirts back, we all took a picture together, me and my deputy ministers, because just like Detroit versus everybody was the Ministry of Health versus everybody, because at that time we didn't have that much support. The Prime Minister supported us, the Cabinet of Ministers did, but nobody in Parliament did, and we had heard not much from the presidential administration. There's been a lot of work done over the last 5-6 months, and most of it is being done through civil society. We, from the very beginning, were working very closely with civil society, with patient organizations, with anti-corruption organizations. We, excuse my language, pissed a lot of people off because we were cutting off a lot of income streams for corrupt practices, and there were a lot of people coming up against us. Those things are continuing now. But we've finally gotten to the point where we've gotten the president on board, we've gotten the cabinet of ministers and the prime minister who's been on board from the very beginning, and now we're pulling the deputies from the parliament on board because civil society is pressuring them into doing their jobs, because they were voted in not to not vote. They were voted in to make a decision. If there's a problem with the law, then vote against it and work on a better law. But to not show up, or to not be present, or to be present and not vote, not even abstain from voting, just not vote, is truly just I don't know, I think it's just a really misuse of the trust that was put into the deputies of the parliament. And civil society understands that, and on Tuesday, tomorrow, at 11 o'clock, 10 and 11 o'clock in the morning, patients of Ukraine and the network of people who live with HIV/AIDS and a lot of other patient organizations, as well as anti-corruption organizations like Transparency International and Center for Anti-Corruption, are organizing the hour of death in Ukraine. Every hour, 67 people die in Ukraine. Of those 67 people, we could save probably 14 or 15 of them if we had a better healthcare system. So in 55 cities all over Ukraine, there's going to be this 1 hour where civil society comes out and says, we support a new healthcare system so that we don't have 67 people dying every hour, from many of which are dying early or from diseases that really could be prevented or treated if we only had a better healthcare system. So I think that that's hopefully will put some pressure in a good way onto the deputies in Parliament so that they realize that their voters are demanding some changes. And if they have a different, better idea, we're open to it. But right now, this is the best idea. This has been worked on not only by us, but by the cabinet of ministers, by the presidential administration, and even by the deputies themselves. And if we put this forward, and we're putting it forward together, this will be a true step in the right direction for Ukraine. And it'll be one of the very few reforms that everybody is agreeing on and moving forward with. Because healthcare really touches every single one of us. Every one of us is going to be, has gone or will go to a doctor, be hospitalized, or our parents have been, or our children have been. And it's very sad that this is the most important of all of the services that can be provided, that it has been neglected for as long as it has been. And it's gotten to such a bad state that the system doesn't even really work anymore. It doesn't even exist. People are afraid to get sick. They don't want to go to hospitals. If they go to hospitals, they are so used to just paying for everything that they just pay for everything, even though now, we spoke before, there's a lot of medicines being provided to them at no cost. People are walking up to me in the streets and they're shocked that they were in the hospital and they didn't have to buy medicines because they actually were there. They've gotten so used to it. It's so sad that everybody's so cynical that they think that they have to pay for everything. So we're going to need to do a lot of programs to educate the public on what their rights are, that when they go to their primary care doctor, they're not supposed to pay anything. When there's an emergency and they call an ambulance and the ambulance comes and takes them to a hospital, they're not supposed to pay anything. It's part of the guaranteed package of healthcare services that are provided at no cost. And that if they or their loved ones are dying or have a disease that's not curable and needs to be, they need palliative care or hospice care, that also should be provided for them at no cost. There'll be a lot of work being done not only to implement the actual change in financing, but also to educate the citizens of Ukraine and those who live in Ukraine what their rights will be under the new laws.